My name is Dr. Jason Gerard. I'm from the United States of America. I'm a doctor of chiropractic and a member of an organization called Chiromission. What Chiromission is essentially a group of doctors of chiropractors which travels across the world, travels across various countries, and what we do is we provide chiropractic care for those in need. People that both need it, people that have never experienced chiropractic care, and we've been to places like the Dominican Republic, India, Haiti, now St. Vincent's, and what we do is we provide the opportunity to receive a service that most people in the world have never even experienced. Well, that's the exciting part, and what's exciting about that is we've come here for a week and we are set to go in a lot of different places, and what we're going to be able to do is provide the opportunity for you to get your spine checked essentially through a professional chiropractor, where we'll come out, we'll come out to various locations and we'll be able to perform chiropractic care on you, and you get a chance to experience it, feel better, function better, and be healthier. There's actually no cost. We actually donate our time. We've been blessed back home, and this is our opportunity to give back. And so there's no cost. It just involves you getting there. We're going to be in police stations. We're going to be at the hospital. We're going to be we're going to go into the communities and the towns, and we're just here to serve. And so we've got a whole schedule set, thanks to the help of Fidel Caesar, who is head of Medical Relief Association. He has actually got us set to go to multiple different places, and that will be distributed out to you guys. Well, to answer that, who would qualify, it would probably be best to take a step back and understand what chiropractic is. You have to understand, for your body to work, for your heart to beat, for your lungs to breathe, for your pancreas to work, your body has to function. And so essentially, you've been put inside of you is with something called a spinal cord and the nerves, which is the one thing that runs your entire body. And so what we're looking at doing is normalizing or improving the function of that part of the body, so that you can feel better, so that you can function better, so that you can be healthier. So we'll see kids of all ages, and adults. I always say we'll see you anywhere from 24 hours old all the way up to 100 years old. Why so many kids? Well, kids fall. They're active. We make a joke that says if you fell as many times as your kids did, you'd be in the emergency room every other day. And so again, and people go to their jobs and they sit forward like this all day. And some people have accidents and falls and play sports. And so what we're looking at doing is checking any variety of people who would want to get their spine and nervous system checked to see if it could help them get to a health level that they've never received before. On behalf of Chiromission, our plan is to be here more than once, and we go into a country and introduce the concept of chiropractic. We are looking at providing donations to help relief in the medical world. We're here to provide chiropractic adjustments. We're here to educate your country so that you'll have maybe some future young people that would want to get into the world and in the field of chiropractic, so that they could go home and help your country be a healthier place. And so we're excited to be here, and again, we just want you guys to come, show up. There's no charge, and we're just giving our time and our donations of ourselves, and some of the stories are miracles. In fact, if I could just tell one quick story, we were in the Dominican Republic, and we had this little 8-year-old boy, and we were adjusting right outside of a church, and we adjusted him, and he had told me that he had dislocated his shoulder. And so he couldn't lift his arm. His arm would just hang like this. And so I adjusted his dislocated shoulder. And what was so great about his story is that he ended up bringing back, just himself, almost 100 people. And every time he'd bring someone back, he'd grab him with the right arm to show me that he could lift his arm up again and pull him towards me. So again, those kind of stories happen all the time. And so we're very excited to work with you guys, and we're excited to see you. All right, so we're going to demonstrate what a chiropractic visit or a chiropractic adjustment is. And it really is simple. When we're out in the community is you sitting in a chair, and then what I'm going to do, we might take a brief history, we might ask to see if you have any health problems or any challenges, things such as headaches, if you have any arthritis, if you have any arm pain, middle back tension, etc. And we'll just ask a little bit about that. And then really all I'm going to do is I'm going to put my hands on her spine and just simply check. We're going to see how it's moving. And when we find areas like this that aren't, we're going to note that. And so what we're going to do now is we're going to get a chance to get her adjusted. And the adjustment, you might hear a little popping or clicking sound, and that's just simply the gases moving out of the body. But you'll often find you'll feel better, you'll move better and be healthier. And in some cases, we see some just incredible changes with people. So we're just going to demonstrate by getting her adjusted. And again, it goes extremely fast. There you go, and you guys might even hear some sounds. And does that hurt? No. Chin up for me. There we go. Good. And then what I'm going to have you do is I'm going to have you stand up for me. You can stand up right where you're at. And I'm going to have you give yourself a hug like this. Okay? And then I'm going to have you lean back. And what we're going to do is just the middle part of the back like that. Good. You can grab a seat now. And so what we just did right there is we just freed up the nerves in the middle part of the spine. We freed up the nerves in the neck, and you probably already feel a little bit better. You feel a little bit looser, you feel less tension, and that's the kind of things you can experience. Now again, we've had people that have had major changes. I one time was in a surgery room, in the Dominican Republic in a small town called La Isabela, where the head surgeon had had a headache 3 days in a row, and she came up to me. We adjusted her right there, right at that time, and she's like, my headache's gone. It's been 36 hours that I've had it. So again, that's what a chiropractic adjustment does. One great thing is we see a lot of tension and stress on the body. We're going to want to adjust you more than once most likely. So if we tell you to come back, we really mean that. Take advantage of that. And again, last thing I'll simply say, if you have problems on your spine and you have children, just like heart disease runs in families, high blood pressure, cholesterol runs in families, so does problems with the spine. And so we'll often want to make sure your kids are checked. And again, we do that at no charge. So again, look forward to seeing you guys out in the field.